we can introduce our presenter, Jenny Catlove. We are excited to have this presentation by the Children's Partnership. Just as background, Children's Partnership is a national advocacy organization that focuses on children's health access issues, and CHSA has partnered with them in the past. Jenny is the Director of Strategic Health Initiatives for the Children's Partnership, and she has a deep background in this area. She has been doing work for the last 15 years in California and Ohio around advocacy on behalf of Children's Health. She's worked specifically on health enrollment issues. She's worked on dental issues, and we've collaborated with her on policy in these areas. So with that, let me go ahead and turn it over to Jenny now to walk us through this presentation. Jenny?
Hi. So Paula, sorry for a little bit of a technical difficulty. I'm unable to advance the screen.
There we go.
There we go. Great. So hi, welcome everybody. We're really excited about this opportunity to both talk to you about healthcare reform as well as identify ways that we can partner. As Rick mentioned, the Children's Partnership is a national children's advocacy organization. We are based in California and DC, and our mission is to ensure that all children, especially those who are at risk at being left behind, have the resources they need to grow up healthy and lead productive lives. One of the issues we work on is making sure that all children have the health and dental care that they need. This is so important, and I know that you guys, as Head Start providers, see this every day and see how important it is to make sure that kids get the health coverage that they need. So, what we're going to cover today is, well, as you probably know, with a focus on health care and health coverage, in less than 2 months, healthcare reform, enrollment in healthcare reform is going to start. And Head Start providers have a huge role to play in making sure that children, families, and workers and employees and adults get the health coverage they need, and we see the Head Start providers as having an integral role in the implementation of healthcare reform, and so that is why we are partnering with the California Head Start Association so that we can partner directly with you. So what we're going to cover today is talk a little bit, give a basic overview about what healthcare reform is, who is it for, when does it start. What about Medi-Cal? You guys, the majority of your kids are probably already enrolled in or eligible for Medi-Cal. How is that going to be impacted? We're going to talk a little bit about how families, adults, and everyone can enroll in coverage. And then the last two pieces are really going to talk through what Head Start providers can do to help individuals enroll. And then we really want to spend a little bit of time on a campaign that the Children's Partnership is spearheading with partners like the California Head Start Association to provide the tools that providers need to enroll kids and connect kids to assistance to enroll in coverage. But first, so it's moving the screens is a little slow. There we go. So first, why Head Start? Well, we know that a key role of Head Start is, and a key mission of Head Start is their commitment to the health of children and families. It's written right into all of your sort of guidelines and parameters that one of the main roles that Head Starts play is connecting children and families to health coverage, and also working to secure a health home for children and families, and then really working hard to connect them to the health and dental care that they need. And now, for the first time, there's a coverage option for practically everyone, including parents and Head Start workers. So while we know that a lot of the children you work with are eligible for and enrolled in Medi-Cal, there are a lot more options for the folks that work with kids and take care of kids. So over the past probably 2 to 3 years, we've heard a ton of different words and phrases and what is healthcare reform. And a couple of years ago, a few years ago, when Governor Schwarzenegger was in governor, he had his own healthcare reform package. So what do all these words mean? So let's get through the alphabet soup really quickly. So Obamacare is the same as the federal healthcare reform. It was sort of a nickname for the federal healthcare reform, but the official word, the official name of the federal healthcare reform law is the Patient Protection and Affordable Care Act. And so that's PPACA, and a lot of people are calling that the Affordable Care Act, which went down to ACA. And then when California, which was one of the first states to develop or to implement healthcare reform, in fact, I think it was the first, they developed the California Health Benefits Exchange. It's actually Benefit Exchange, sorry, there's a little typo there, or HBEX. But then the state said, well, we really need a more family-friendly name, and so Covered California is really the name for our healthcare reform law. And what Covered California is, it's the marketplace where individuals can go and get affordable health coverage. And we're going to talk a little bit more about that. But so all of these sort of mean the same thing. And Covered California is the term that you're going to see a little bit more of as we go forward. So I'm going to stick to just the marketplace for a second. So Covered and then we're going to talk a little bit about Medi-Cal. So Covered California, the state anticipates that 5.3 million uninsured California residents will now be able to get health coverage through Covered California. And this is where they're going to go and shop for a variety of options. 2.6 million will qualify for financial assistance through tax and cost-sharing subsidies. Here's an example of what a typical income would be. Since Head Start providers do work with federal poverty levels, I'll just let you know that this is for folks, for adults between 138 and 400% of poverty, and then children between 250 and 400% of poverty. And then 2.7 million, the other sort of half, will not qualify for subsidies, but will be able to purchase coverage through Covered California, and it should be at a lower rate. So what about Medi-Cal? So 2.4 million adults will become newly eligible for Medi-Cal. This is for children. This is for adults at 138% of poverty or less. So this is family of two, $21,400. This is incredible because this means that all of the parents that you work with, if they don't have health coverage now and they're at or below 100% of poverty for the typical Head Start child, their parents are not going to be eligible, even at higher levels. So we know that Medi-Cal is going to make a huge difference for your Head Start parents. And then there are about 500,000 children who are eligible but not currently enrolled in Medi-Cal. Eligibility for Medi-Cal is not changing, but there are a lot of kids who are eligible but not enrolled. And as most of you probably know, the Healthy Families Program was eliminated last year, and this year is the transition period where nearly 900,000 children are transitioning from Healthy Families to the Medi-Cal program. Now that income level is a little bit higher, as you guys know, but I suspect you probably still have a few families that may be eligible, who may be in the Healthy Families range, but will now be in Medi-Cal. So how does Covered California work? So starting October 1st, families will be able to apply for health coverage either online. There are going to be service centers, which are going to be regional centers where you can call and get help applying. In person at county offices. These are your county, the Department of Social Service offices or the Medi-Cal offices, which isn't how we typically apply for health coverage. We know that. But because there's going to be a link between Covered California and Medi-Cal, there's going to be a cross-referral system. So if you go into a county office and you're eligible for Covered California, they're going to be able to help your family enroll in coverage through Covered California. And that at community sites where sisters will be available to help. And we're going to talk a lot more about that fourth bullet as we move forward, because we know that, and you know, as you've helped families enroll in Medi-Cal, it can be very complicated. And even though the Covered California website is supposed to be fairly simple, and it will help, and it will actually refer families to Medi-Cal if they are eligible for Medi-Cal and not Covered California, we know that a lot of families are going to need help. The state has spent millions of dollars, is spending millions of dollars on outreach and enrollment, both on an outreach campaign to educate families and individuals about healthcare reform and how to enroll, but also on what they're calling navigators, which is similar to our community application assisters, certified application assisters. So there are going to be lots of folks on the ground who are going to be able to help. So we're going to talk a little bit about that later. Sorry, I need to advance these a little bit quicker. So when can folks enroll? So open enrollment for Covered California starts in less than 2 months, October 1st. Through March 31st. So it's important to note that families will not be able to, for Covered California, there is a limited period of time for which you can actually enroll. And note that while enrollment starts on October 1st for those eligible for Covered California and adults eligible for Medi-Cal, eligibility eligibility actually starts on January 1st. So they'll be able to start using coverage on January 1st. Children, as you know, can enroll at any time, and adults will be able to enroll at any time after that first initial period. But the Covered California piece will only be for 6 months at a time, and then it'll start over. So it's important that we get everybody enrolled quickly so that they have the coverage. So that's sort of a basic overview. I mean, it's very complicated, and everybody continues to learn about the eligibility, how families will choose. It's important to note that all children who enroll in Covered California will have access to dental coverage. And there's, and it's a little bit complicated, but we just wanted to do a quick overview so that you knew what was going on, and we're going to be available for questions on sort of the details. But it's important now that we talk about, how to get folks enrolled. And you guys are experts at this, but I want to talk a little bit about the role Head Start providers and other trusted entities play to help get the word out and connect people to coverage. So this is sort of the action part. So for the next few minutes, I'm going to talk through a few ideas and maybe give you guys some brain teasers. And then in the question and answer period, my hope is that we don't just ask questions, but my hope is that you guys can also shoot out some things that have worked. And we'll talk a little bit about that later. So what can folks do what can Head Start providers do to identify uninsured children, families, and individuals and connect them to coverage? So ask families about health coverage status and enrollment in health fairs. Identify uninsured workers and provide them with information about health coverage options. Ask when families are submitting immunization records about health coverage. And then another idea is to send postcards and letters to families and employees, letting them know about health coverage options and providing them with resources to enroll. And again, I just want to remind folks that it probably makes sense for you to think through how do we get to those different populations? I suspect that you're fairly used to talking to families about their children's health coverage status and their health coverage status, identifying pregnant women in the family, making sure that they're getting coverage and care. But it's important that we also remember that there may be some workers in your program, perhaps part-time workers, or maybe your Head Start program is in a community center that is not exactly connected to Head Start per se, but that community center actually may have adults that are eligible for health coverage through Cover California. So this is a time for us to start thinking outside of the box, that our job is to really reach into the full community to identify individuals, families, and children. And why this is, I think we all know why this is important, is because one, it's really important that everyone has the health care that they need, but this really impacts children, to make sure that parents, the people who take care of them, and that we want a healthy community for everyone so that our children can grow up healthy and strong. Sorry, it's a little slow. So the other piece is displaying posters and flyers, provide information at health fairs, parent nights, and other events. Train personnel to educate families, employees, send texts to and place calls to families. So texts are everyone's using text messaging to get messages out to our families, and placing robocalls as reminders, and submitting articles and newsletters that go to families. Now I'm going to stop here and say, I know that this sounds like a lot, but at the end we're going to talk through how we can be helpful and even help you tailor different materials. So if you're interested in some of these activities and you don't have the resources to really create the materials, or we're going to talk to you about how we can work with you. So other ideas that have worked well, and this is where we're talking, this is one of, I think some of these are some of the sort of more hands-on activities, which is providing postcard size forms or any size forms to families to fill out and have a sister contact them. So one scenario could be that you partner with a community-based organization, or maybe you have an assister on staff yourself, and at the health fairs or enrollment, or even at any time at the front desk, you have a form that families can fill out, and it's very simple. It's really, are you interested in being contacted about health coverage? They give their phone number and maybe even email address now, and then you work with a community-based assister to actually follow up and come on site to enroll those families or call them and do home visits. It's really important that we close the loop on a lot of these. I think the general information, the postcard or the flyers and the posters, getting the word out is really, really important, but then also having that next stage where we can really connect them to coverage, and coverage assistance is really important. And then one piece is we know that Head Start providers often may have classes with parents or a parent night, or one of the things you could think about doing is having an enrollment night where a sister or a couple of sisters can come and help families. Maybe they bring a couple of laptops, and and you provide child care, and the parents are there, and you can get families and individuals enrolled in coverage right there at at enrollment night. So I'm going to talk a little bit about our outreach campaign to education providers, and talk to you a little bit about what we're doing and how we can help you. So we have launched a year-long campaign to help folks like you reach out to families and individuals about health coverage. Why this campaign, and we're in the infancy stage, and I'll let you know that even just this week we're starting to develop a branding, a look for us, a branding look, and we're starting to develop materials in the next couple of weeks. And so pretty soon we're going to have a fairly robust campaign that's really there to help you. We will say that the Cover California and the whole effort around healthcare reform, a lot of it is focused on adults. And we know that, and a lot of it is, and there is an effort to reach out to schools and child care providers and early childhood education providers and after-school providers. However, there's not one focused effort, and that's what we want to do. We want to make sure that there's a focused effort on the school and early childhood education community so that they have fact sheets that are tailored specifically for them, that they have newsletter articles that are specific for them, so that the message is really tailored to you, actually, and the families that you serve. So what you will see in the next few weeks is we are going to be developing fact sheets that will talk about what you guys can do. And we can work with Rick and the Head Start Association to develop a fact sheet that's tailored for the Head Start community. Some of these fact sheets are going to be where you can tailor them and put your own phone number in them. And so we'll have, we heard from lots of folks that it's really important to have materials that individual organizations and communities can tailor to themselves. There are going to be statewide phone numbers, but we also know that it's probably the better approach is to connect to a community provider. So we'll have template newsletter articles. In fact, we already have a couple of newsletter articles that you can tailor that are on our website, which is at the bottom there. And we're hoping that you guys can use those. And we are really open, and our contact information is going to be at the bottom of this. But we want to hear directly from you about what you need, what works, what doesn't work, and how we can help you directly. I mean, we really are here to help you individually. So other things is postcards. We heard that lots of folks are really interested in having a wallet-sized card that you can pass out, so that parents are really busy, they're just dropping off the kid, but if they have this wallet-sized card, they'll have a phone number to call and sign up for coverage. Template robocalls and texting scripts. Schools use robocalls all the time, and it's really helpful to do those reminders. So let's say you do want to do an enrollment night. You can use robocalls to remind folks of those enrollment nights. Sample PowerPoint presentations, we'll have those on our website, or we can help you develop one. So just like this PowerPoint presentation, we can help you develop one. So if you're doing a presentation at a parent night, or even to workers, whatever population you're interested in, we want to have a short YouTube video. We'll have sample talking points for you, and we'll have, if you want to put web information on your website and a badge on your website. And we'll also have connections to community resources listed on our website. And we have links to on-the-ground community providers as well, and so we can help identify community providers.
Hey, Jenny, this is Rick. May I just jump in for a moment?
Yeah, please.
We have questions that we'll ask you at the end of your presentation, and I'm not going to interrupt you with all of them, but there was one that came up that I thought maybe I should pose to you right now, which has to do with translation of materials. And we're wondering if, to what extent whatever, materials and resources you're developing, which sound great, will be available in other languages.
That's a really great question, and I probably should have put that here. We will be translating everything into Spanish for sure, and then we're hoping to work with, we don't have a lot of resources for translation, but our hope is that we can work with folks to work on translation, and I think we're going to be able to get some materials translated for sure in other language. So for example, we are looking to forge relationships in Los Angeles, for example, the Korean Resource Center, and our hope is that we will look to translate materials in various communities. So we did a lot of reach out to communities in the last 6 months, and there's about 5 to 7 different languages in different communities, and they're all different. So we know in the Bay Area there are 3 or 4 Asian languages in Arabic. We know in the Central Valley there are 3 or 4 Asian languages, but they're different Asian languages. So we know that that's a need, and we will do our best to meet those, and Spanish will be the #1 that we do have resources to do.
Right, good, good. Well, that was, Spanish was, clearly far and away the greatest need, and we appreciate whatever you can do in the other languages. Thanks.
Right. And if you guys have resources for translation, the other piece I want to mention before, is that a lot of these materials are going to be very web-based. We're not going to have a lot of print materials. They're going to be things that you guys can download and will be able to be tailored. So if you have your own translation resources, you can do what you want. You can translate them. But again, this is really trying to think of the right word, but it's really a working together. Things aren't set in stone. How can we work together to shape things and be iterative and to build on our lessons learned? Even in the first 2 weeks, if we learn something, we're going to make changes as we move forward. It's really important that we don't have something just set in stone and that don't work for folks. So we are actually nearing the question and answer period, and in addition to the questions that I can answer about healthcare reform, I do want to hear that the translation question was really important. What tools and materials would be helpful? What else do you need? And again, you guys have been working with these families for probably longer than we have, and you're on the ground every day, and you know as times change, different needs, families have different needs. And so if you guys have not just questions, but advice for us, what works best, what would be helpful, because you know that this is, you did something in the past to get a family enrolled in Medi-Cal, we could use all the advice we can get so that we're really meeting your needs. So in the question and answer period, please, in addition to questions, it would be great to hear, some great best practices from you. So here is the contact information. We have full-time staff on this project. We have the web page. If you get on the web page right now, it is very thin. We are building it as we go, and soon you will see a lot more resources. And I do want to let you know that we have some on-the-ground partners. So we are working with, some of you may be familiar with the Children's Health Initiatives, and these are county-based coalitions that work to connect families to health coverage and health care. We are going to have some resources and work with the Children's Health Initiatives to connect families who may not be eligible for health coverage to programs that they are eligible for. So some of you may know about the Kaiser Children's Health Plus program, Child Health Plus program, which is a health coverage program for children who are not eligible for public programs, maybe because of their documentation status. There's a variety of resources in different counties, and so we want to make sure we can help connect folks to those. I think that's it. I'm going to stop there, and let's go to questions. And as Rick said, Rick's going to sort of read off the questions, and I will try to answer them as best as I can.
Super. Well, first off, Jenny, let me just say thank you for a really helpful presentation, and just for the great work that you and the Children's Partnership are doing. You're great partners to have in this. Now, in terms of the Q&A, let me just share with folks, especially folks who came in a bit later, just given the volume of people on this call, we have 93 participants. We would love, in an ideal world, to have you be able to use the audio to ask your questions, but it gets too difficult with people talking, over each other. So we're asking that all questions and even all feedback just be typed into the question box. And we've had a number of folks already type things in, which is great. So I will summarize questions. A couple of them have already been addressed, and I'm sure this conversation will spark more. So let me just go ahead and start on this. First off, people are just asking about the presentation, so and access to it. So the slides will be posted online after this presentation, and we also have a recorded version of the webinar, and we'll have a link off of our website, so someone can actually go back and listen to the recorded webinar as well after the fact. There were a couple questions regarding materials early in the call, but I think you've addressed that. There were a couple questions about how staff can become enrollment assisters. And, I was wondering, Jenny, if you could talk a little bit about that process.
That's a great question. And I don't have the exact answer, to be honest, but I think that, first of all, staff can definitely become enrollment assisters, and I think that's a really good question. And I think, I think what we need to do is we will research the process for that, and it may even be easier this way is we'll research the process for that. Rick, can you send that out to folks? Because it may be that not only will we be able to research the process, we'll be able to provide like a link and the phone number to where folks can sign up.
Sure, yeah, we have a registration list, so we could shoot an email out to folks. And also, for folks listening, you're probably getting a sense of this already, but since enrollment doesn't begin until October 1, a number of these kind of systems and materials are in flux and development. So yeah, that's why not everything is nailed down, but we just felt it was better to organize the webinar now and start the conversation so we could folks could try to stay ahead of things. So, but thanks.
And yeah, and then just kind of dovetailing on, I know we want to get back to questions, but before I forget this point, I want to make clear that this is not a one-time shot in terms of this webinar, that the California Head Start Association and we are partnering to provide you with the resources you need. So as things come out, I'm hoping the Head Start Association could be emailing things. We can also do another webinar. Perhaps we do a webinar in January because people are going to have questions. I tried to help my family sign up, but this is what happened. So this is an ongoing partnership, and we're here to provide you with the resources you need. So let Rick know what it is you guys need.
Well, that's right. No, I appreciate that. And as a matter of fact, we had Anthony Wright from Health Access keynoting at our Health Institute in the spring, and I imagine you or someone from Health Access will be at our Health Institute next year in January too. So we'll be pushing out information through a variety of means. The next question, Jenny, is regarding the enrollment window and timeline, and it's about the what happens if someone loses their job after the enrollment period ends, say after March 31st of next year?
That's a really good question, and there are exceptions to my understanding is that there are exceptions to the open enrollment period. It's very similar to folks are familiar with the Healthy Families Program, which is for if there are reasons there are exceptions to the open enrollment. My understanding, and I will have to, again, I'm going to follow up on this, so we will confirm this, but my understanding is that there are exceptions to the open enrollment period, which are loss of job and some of those other reasons that loss of job or loss of insurance that will allow families to enter outside of the open enrollment period. But again, I've heard that, and I need to see it in writing before. I would rather confirm that and send out an email before we set that answer in stone.
Yeah, good, thanks. A related question is, for medical, does the person have to reapply every year? and or in other words, once you've enrolled, are you in forever, or do you have to sort of recertify?
It is going to be like, it is not like Medi-Cal where you have to reapply. It is going to be, it's a health, basically you're getting coverage through a private health plan. So, I'm not quite sure exactly how that works, but I'm pretty sure that it's very simple and that you probably stay on. And if folks have health coverage through these plans, they most likely keep you on. But again, I need to research that one, and all of us are learning as we move forward. And these are great questions because this is going to help us prepare other folks for this. But yeah, my understanding is it does work just like other private health coverage, and I don't think you have to proactively reapply. That you'll be working with your health plan to maintain that coverage.
Although to be clear, I mean, if there's a sliding scale on the premium, then
yeah,
we'd probably recalibrate that each year.
Exactly, and so that's
okay.
what I think we need to research is you'll be working with your health plan to keep your coverage, but if you're interested in a different subsidy, or if the state needs to see your income for the next time, then we need to see how that works.
Yeah, that's good.
I'm glad you guys are thinking ahead.
Yeah. There was a related question whether non-documented persons would be eligible for this. I'm assuming not, but I wanted to confirm that with you.
So federal, that undocumented adults and children are not eligible for coverage through Cover California because they are federal subsidies or through Medi-Cal. And so there are some programs across the state for children, so the Children's Health Initiatives, and they vary by age and by what they cover. I'm sure a lot of you are familiar with those programs, and a lot of the programs for children in some of the counties are covering children 0 to 5 right now because a lot of the first $5 are paying for those. The coverage for 6 to 18-year-olds, I think it's open in some counties, not others. I know Los Angeles is closed for new enrollment, but they've transferred folks who are currently enrolled into a program called Healthy Way LA, which provides, it's not exactly health coverage, but it's a clinic-based system that will provide the kids all the care that they need. So it's going to be, as you know, when we look for resources, health coverage resources for undocumented, it's going to be by county and it's going to be by system. And unfortunately for adults, there's not as much there. And, we continue to work on that. And the Children's Partnership has a huge, the Children's Partnership is working very strongly to try to find resources for undocumented children and adults.
But given that this is a federally funded, congressionally authorized plan, and we know what the politics in Congress are right now, it's, it would have been, the Affordable Care Act never would have been passed if they were more sensitive, if we had to be more sensitive to undocumented persons.
Exactly.
Okay. Sorting through these questions. The question is, we were told in an official Cover California educator training that the only resources we were to use to give to families regarding enrolling were to come directly from Covered California. Will our materials be approved by Covered California?
That's a really good point. And so Covered California does want to maintain a streamlined or a simple message, and for the message to come, to maintain a message. However, that's actually not exactly true because we are working with Covered California, and they've reviewed our materials, and they are happy for other folks to be doing outreach around this. And to be honest, you can't really stop folks from doing outreach, but we're working very closely with them, and they're very pleased that we are taking this focused effort on the education community and the early childhood education community, because they know that they can't reach everybody. So we're running everything by them, and they have taken a look at a lot of our materials and are giving feedback. So that message, we understand that, different people are giving those trainings, but, and it's unfortunate that that message came through, because they are doing Cover California outreach, but, there is Medi-Cal as well. So there are going to be a lot of materials. And in fact, the California Endowment has their own campaign as well in English and Spanish called Get Covered. And so there are going to be a few efforts out there, and Cover California, is fine with other efforts going out there. But we will say that we are coordinating very closely with them. So we are running our messages by them so that we're saying the same thing, and we are also referring to the right resources that they are referring to.
Great. I think that answers the question. That's very helpful. Another question is, will this new coverage also apply to seniors?
No, seniors are still going to be in the Medicare system. This is for adults up to age 65, 64.
Yeah, that makes sense. Then there's a couple of questions that have to do with, that are really sort of inside Head Start questions, which, there's some good points. I want to acknowledge them. One has to do with sort of the suggestion or idea that future program information reports include a question regarding the insurance status of parents and guardians. That's, I think that's a good one to raise as we work with OHS. There was another question regarding how the healthcare coverage option will affect the comprehensive health services that Head Start provides, and whether there's the health staff's role will remain the same around comprehensive health for children enrolled in the Health and Head Start program. I'm not sure I have a definitive answer, but I can at least speak to it. My take would be that we have, with this new program, the need for the health specialists and our health managers is as strong as ever, because we
greater.
We have huge issues around communication, enrollment, finding health and dental homes. All of those things continue. So I appreciate there's this broader conversation happening around the nature of Head Start's comprehensive services. I don't see this law as undermining the need whatsoever for our health specialists.
Yeah, when my second slide, or the third slide about why Head Start, I was hoping to speak exactly to that point, which is that the health specialists are even more, and the health managers are needed even more right now, because there's so much more work to do to get and we're in a newer world, to get everybody enrolled in coverage and connected to care.
Right. So, interesting question just came in, following up on the undocumented question, and the question is, can undocumented parents apply for health coverage for their children when the children are have legal status?
Yes, and that has always been the case with Medi-Cal. I mean, health coverage is about the individual, and eligibility is about the individual. And so this is encouraged, that, and oftentimes, especially with the children, with the younger children, oftentimes younger children are born in the United States and are documented, and absolutely those children should be enrolled in Medi-Cal or Cover California or whatever they're eligible for. But with parents' documentation status has no bearing on the eligibility of the child, and no parent should be afraid to apply for coverage for their child. No information related to their documentation status will be asked of the parent. This is really, really important so that we just need to work with our parents so that they're not scared to get health coverage for their children.
Great, great. There's a timing question regarding when health coverage under Covered California begins for adults and whether there was anything available prior to January of 2014. It doesn't sound like there is, but I just wanted to
there is a program, there is a county-based program called the Low Income Health Program, LIP, and it is a program that provides, it's a program that's county by county, and so you would need to go to your county Department of Health to find out more if your county has such a program, but most counties do. And it's a program that is for low-income adults that allows them to get health care. It's shaped differently in every county, but some counties, for example, provide a card and you can get care at a number of clinics. But again, it's different in every county, and I encourage folks to go to their county departments of health to find out if they have programs for low-income adults. Those adults will then be transitioned into the Medi-Cal for Adults program January 1st.
Mm-hmm. Okay. Question regarding what agencies, or if you can fill in any more information, what agencies or entities will be designated as navigators for Covered California?
So anyone can become a navigator. And so,
and to be clear, Jenny, when you say anyone, you mean, so it's not necessarily tied to the agency or entity, it's really an individual designation for an individual person?
No, I apologize. Okay. You do need to be attached to an organization.
Okay.
It's important. You do need to be attached to an organization, and you need to get training and certified, and then you can become an enrollment entity. It's very similar to the Healthy Families or the CAA process that we had. And we will send out information on all of this regarding that first question about becoming an enrollment assister. So that'll be really important. And then if you're not interested as a Head Start provider in becoming an enrollment assister, we will be able to help you connect to one in your community.
Great, great. Well, we've gotten through a lot of content here, Jenny, and we appreciate your fielding all these questions. We're getting close to the end of the hour, and before we close, I wanted to give you a chance to make any closing comments before we wrap it up here.
Yeah, I would love to say a few things. One, as Rick said, we're all learning as we go, and a lot of the things that Cover California, it took a long time for there was more work than there was time, and so the state is still putting things together before October 1st. Those 3 questions that you have, we will follow up in an email about how to become an enrollment assister. Are there exceptions, and what are those to open enrollment, and what is sort of the annual renewal process, or how long does that income level last, and when do you recalibrate eligibility or your financial assistance? So we will get back to you with those answers. We are really interested in partnering with you, and we want you to email us with questions or ways that you want to work with us. On our website is, at the Coverage for Schools part of our website, there's a place where you can email us. And then secondly, or you can email any of the names on our contact sheet. My colleague Melissa or I are open to any questions you have. And then finally, there is a sign-up section on our website, and shortly we're going to start sending out materials and updates to folks. And so those are the things. And then finally, please let Rick know of anything we can do to help. And we would love to come to your health institute in January to sort of do take two of this, since we're right in the beginning, and I think January would be the perfect time to have this conversation again.
Wonderful. Thank you, Jenny. And before we close, I also want to mention another resource to anyone on this call. CHSA actually manages a listserv around health issues specifically. And so when we get updates, we certainly, Jenny's follow-up email will just go to everyone on this call, but it's actually, this health listserv is a great way to stay in touch on any number of health-related issues. And you can easily sign up for that by going to the CHSA homepage, and there's a box, a kind of a bluish, purplish box that says Join, and then there's a bullet that says CHSA Member Listserv. You click on that box, and then you can enroll in it, and we'll keep you up to date. But wanted to thank everyone for joining us on this call. I think we all learned a lot, and we look forward to working with you all in the next year on tracking this new law and enrollment, and helping get our children and families enrolled in health insurance. So with that, we'll sign off, and wish you well until we see you again soon. Thanks. Goodbye.